Doctors of Reddit, do you ever find yourselves googling symptoms, like the rest of us? How accurate are most sites' diagnoses? I've worked into emergency departments and doctors have no shame in googling something they don't know. It really saves them from making an error and allows them to continuously learn different things. In the air you see so many different things and are bound to come across cases so unique that you hardly have any background knowledge. Anything Google usually comes from a reliable medical journal and docs generally cross-reference to verify information. My doctor actually Googled something right in front of me. She used fancy medical terms and a fancy medical source though. Piggybacking here, a nurse for 8 years will Google to get a quick and dirty on a specific disease. Up-to-date and licensed resources for a more in-depth comprehension. I also regularly see doctors watch YouTube videos for specific procedures, such as reducing a jaw dislocation. 4th year med student here. My diploma might as well say the Google School of Medicine when I graduate. When I was a 2nd year I got a t-shirt made that said Wikipedia School of Medicine. It's silly and I don't wear it, but man, it's so true. Proud graduate of Khan Academy here. I went to the doctor last month, and she was like, I'm going to be honest, I'm not totally sure, but what I can say is it's not life-threatening or serious at all. I'm going to ask my colleague quickly for her advice, and then after you leave today I'm going to Google it, look around, and call you next week to tell you what I found. To tell you the truth, these are the signs of a good doctor. Slight sneeze check, WebMD prepares will. My entire day is ruined by my crazy imagination that I've contracted Super AIDS Zika H1Z1 Omega and there is no hope for me. I'm a doctor and I use Google. Saw a good quote the other day, from doctor to patient. Don't confuse my Google search with your Google search, which I think is very true, which definitely impacts on accuracy. That was the first example I could think of. For your information, for patients I recommend Patient Co. UK and NHS Co. UK. My doctor googled canker sores right in front of my face and spelled out CANCER on Google as I watched in horror before he corrected his mistake. Ask Gregory House. You might be surprised at what he knows. What was the website? AskHouse.com or something? I will never not upvote a house ref. Doctors look up stuff all the time, but on reputable, and often paid, databases. In the hospital where I work we use up-to-date. I have no shame in saying that I regularly watch YouTube videos of surgical procedures before the OR. Maybe one day I'll start taping my own cases for review, but for now I find YouTube to be a good way to get in the zone and start visualizing the steps of the operation, even for routine things. Occasionally, I'll also see a different approach to a problem that I hadn't thought of. I think it's useful to get a fresh perspective like that. Family practice physician here. I tend to run into mostly the same illnesses and complaints day in and day out, but I will Google symptoms if diagnosis has ruled out the most common options. I will say, however, that for most problems that bring people to the doctor, upper respiratory infections, minor injuries, the websites are actually quite accurate. Their drawback is, of course, encouraging the hypochondriacs that they might have a rare, incurable form of cancer, a tropical disease, or super AIDS. Would you say that upper respiratory infection is the most common thing you see people for? What are the other complaints in the, say, top 3 or top 5? Double quote. I've seen almost all of Dr. House, the first 5 or 6 seasons of Grey's Anatomy, and I binge watched Scrubs numerous times. Does that count? If it's good enough for Scrubs. What profession doesn't Google stuff they don't 100% know off the top of their head? A professor told me in med school that the main aim of med school is to teach the students how to take a proper history, perform a thorough physical examination, know a few of the common ailments, and, most importantly, weigh how to look for the answers. Essentially you learn the basics of medicine and pick up the rest following graduation. The first month of residency is quite mind-blowing, but I just found myself going back to the basics as I was taught, and the management algorithms can be referenced somewhere. Books, internet, a senior doctor. So give me the bad news, doc. Well, after googling your symptoms, it seems that you have lung cancer, herpes and gonorrhea. That must have been a hell of a weekend. Doctor googling. Knee pain results went. Brain cancer doctor. Your duct. I went to a doctor for 6 months complaining of chest pain, relentless cough and malaise, among other blood cancer symptoms. I did Google, he knew it. He didn't take my symptoms seriously and I almost died. I was extremely close to death and his medical partner wife was scared shitless because she knew exactly what he had done, not taking me seriously. I diagnosed myself needing an ulnar nerve transposition via Google. My GP and the local hospital disagreed. I complained and moaned for 2 years in pain. Saw a consultant. Within 30 seconds he felt my elbow and said, "Oh boy, yes, I can feel your nerve slipping around, operation soon." Met, unless of course I've just been such a monumental pain in the ass they want to hack me open to shut me the feck up. D. First year doctor here. Completed all of medical school. I do, and sometimes I haven't heard of a certain syndrome or condition. Or when patients tell me the brand name of a drug which I've never heard of yet. Or often what a medical acronym in the notes mean. For the most part, we will use more reputable circumstances like UpToDit to read up about pathophysiology and investigations. I would rather have a doctor Google something they didn't understand or was not up to date on, than have them stubbornly insist that their information method, which they didn't update since med school and has changed since then, is correct. I had to switch sleep doctors for that reason. I've been seeing one for like a year, and I haven't been having any improvement. I kept telling her that the treatment isn't working, and she kept telling me that it should be. That is not very helpful. Not a doctor, but had to take my son to A&E with strange bruising on his legs and pain in his knee. The doctor said the symptoms rang a bell for a condition he'd heard of but rarely seen and he couldn't think of the name. A quick Google and he came up with the Henoch-Schönlein purpura. Urine and blood tests confirmed that this was indeed what my son had. Diagnoses are considerations, so if you put symptoms in, you get a lot of diagnoses that aren't technically wrong. We don't usually Google for diagnoses. We have an idea of what it is, then search for evidence to support so, on trusted sites like PubMed, UpToDit. This usually applies when we are considering really esoteric conditions. Commonly, we do play with our phone. That's when we are keying in values to calculate scores that guide our management, e.g. MedCalc. Nice. Please smash the subscribe button to enjoy daily AskReddit content. The amount of comments which start with "I am not a doctor, but" is really high in this thread. Absolutely, up to date and current are the bomb. When I was an EMT, while en route to the hospital I would be in the back quickly googling the condition the patient called 911 with so that I would be certain to hit all the right tests, diagnostics, treatment, etc. I knew the info, but with all of this knowledge at our fingertips, it would be dumb to assume you know everything and not make a small effort to ensure you cover all of your bases. Not a doctor, but I work in a pharmacy. For us it's less that we're searching on the internet, more that we have resources that you won't have at home. I work in the ER and I use the internet all the time, usually UpToDit or Medscape. A procedure I have not done for 2 years, I will watch a video first to refresh myself. Someone presents with a strange symptom or physical examination finding that is tickling my brain from medical school a decade ago. I will try and scratch that itch. As someone who has to know something about everything, I spend a lot of time doing research when things don't fit a specific pattern of disease that I usually encounter. I'm just a third-year medical student, but I routinely see my doctors searching these apps, not through Google of course, but through UpToDate. We look things up constantly, but on evidence-based medical databases such as UpToDit.com, not Google. I use Google all the time, but it definitely helps to know the names of the symptoms you're searching for, and NBSP. If you're looking for information about why a patient in the ICU is having jerking movements after receiving CPR during a cardiac arrest, you get better results for myoclonus than you do for jerking movements. because jerking movements gets you information about seizures and movement disorders like Huntington's chorea and NBSP. Also, results containing proper medical terminology are much more likely to have been written by a credible source. I'm an IQ nurse manager. We all have no shame in googling anything. Work in pharmacy and Google all sorts of stuff, often looking for journal articles. Using credible sources isn't so much about how you found them, it's more about being able to assess whether or not they're credible. IQ nurse here. Our docs Google shocks all the time, especially the smart good ones. Good providers can't be afraid to admit when they don't know something and need to seek out the proper data in order to formulate a plan.